Good afternoon, everyone. My name is Praveen Kanda. I am the VP of Intellectual Property and Innovation for MTBC. And welcome to the second of the MAC Board series that MTBC hosts with our medical consultant, Dr. Gupta, who has been working with MTBC to initially improve our EHR and now has also been consulting regarding healthcare matters such as ICD-10 and meaningful use stage 2. Today, we will talk about the timeline to achieve ICD-10 and meaningful use stage 2 successfully in this year or 2014. So, Dr. Gupta, one of the major things that providers need to understand is meaningful use stage 2 and ICD-10 are two rules. Can you please go into the description on what these two unique rules are?
Hi, Praveen. So meaningful use and ICD-10 are two different federal directives, but both are an attempt to achieve improved quality of care as well as reduce cost of care. So both of the programs geared toward improving patient care. In 2014, we are faced with many deadlines, which involves both meaningful stage 2 as well as ICD-10. So if you are an early adopter, when you start using meaningful use stage 1 in 2011 and 2012, then you need to implement the meaningful use stage 2 in 2014. And you also have to keep in mind that ICD-10 implementation deadline is also October 1st, 2014. So both of those programs need to be implemented in 2014 for this group of people. And that brings you to a 2014 regulatory storm. That means you have so many regulations to meet deadlines to be able to achieve that. And we can do that. It is doable.
So before we go into the exact timeline for these regulatory storms, can you explain to our providers what the similarities or objectives are for meaningful use in ICD-10?
The key thing to focus on meaningful use and ICD-10, as I mentioned, is they focus on improved quality of care. And both the directives have an objective to improve clinical data capture. That is to be able to capture what doctors are doing and to be able to bill appropriately and be able to do that, rationalize the care cost. So for meaningful use component comes into play because it is incentive-induced process to enhance clinical data capture, sharing, and outcomes measurements. So as to enhance doctors to start using EHRs so that they can have electronic data capture that is more legible and clear. And ICD-10 focuses on how to mitigate coding challenges for enhanced clinical information capture, rationalized care cost, and payer-provider integration, which also focuses on ultimately how to capture clinical data more accurately. So both the objectives are focused on clinical data capture.
So I also know that both of these programs require some technology changes. Can you please go into a few of these technology changes?
Same thing. I think we talked about to be able to capture data more accurately, we really need to use electronic technologies. That's why the move towards electronic health record, it's needed for that reason. So for meaningful use, you have to make sure that your EHR is 2014 certified. This certification involves that EHR is able to do things that's going to make data entry, data capture, and data reading more meaningful. That is using this technology more in a sense that actually makes the process more useful. And ICD-10 is also requires some kind of an electronic data capture because to be able to really document and accurately capture what the doctor is doing, and with ICD-10 codes, you do need an software that can do that. So EHR system that has upgraded to ICD-10 codes are something that you need when you go for an EHR.
So one of the things MTBC would like to assure all of our providers is that our meaningful use stage 2 certification has been conducted on our MTBC web EHR, and we have met the requirements for being certified and are fully compliant with meaningful use stage 2. In addition, we've also designed upgrades to our ICD selection where you can select ICD-10 codes in addition to ICD-9 codes. This allows providers to search ICD-10 codes with their ICD-9 code that they used prior, and once they select that ICD-9 code, they can actually select the relevant ICD-10 codes. Now, for providers who followed ICD-10, they know that there are 3 times as many codes, which means there's only a about 20 to 30% of the codes that have relevancy from ICD-9 to ICD-10. In order to combat this problem, MTBC also added a feature where you can search the relevant ICD-10 code and select that ICD-10 code, which will go automatically into your My List. This will let the provider pick the relevant ICD-10 code for that patient. Now, Dr. Gupta, I know we're talking about the technology changes, but shouldn't providers also have some other types of changes within their office that they have to consider for these two groups?
It is they really have to really focus on their workflow, because in order to implement all the technology to be able to capture data more accurately, you really have to focus on the workflow. For meaningful use, the workflow changes really requires how to be able to tell the patient so that they can start using the patient portals, and also to focus on clinical data exchange electronically. Those are the two new components that's added to Meaningful Use Stage 2, which is much more important for Meaningful Use Stage 2 and further, as well as for ICD-10. And this workflow changes also involves changes in more enhanced and detailed and specific documentation. So this workflow change for both ICD-10 and Meaningful Use will involve ICD-10. And this workflow changes also involves changes in more enhanced and detailed and specific documentation. So this workflow change for both ICD-10 and Meaningful Use will involve meetings with your key stakeholders in the practice so that they all get involved in the process, whether it's the physicians, whether it's the staff, whether it's the billing staff, nurses. Everybody has to be inventive and work together to reach the goals of Meaningful Use as well as ICD-10. So that's going to be the major challenge that we have to face in ICD-10 implementation as well as Meaningful Use Stage 2 implementation. And I think we're going to have a separate webinar to focus on that alone, because that's big changes that we have to incorporate.
So now that we've talked about the objectives and the technology, I think it's a really opportune time to start talking about these deadlines and when this timeline exactly is. Now, a lot of our providers know the basics that we have to meet MU Stage 2 and ICD-10, but can we go clearly more into actually what the deadline is for MU Stage 2 for this year?
Yes, I think if you look at the timeline, and it makes more difference if you start focusing on when did you start using Meaningful Use Stage 1. If you are early adopters and start using Meaningful Use Stage 1 in 2011 and 2012, then you have fulfilled the 2-year requirement for Meaningful Use Stage 1. Then 2014 is the year for you to implement Meaningful Use Stage 2. Know that Meaningful Use Stage 2 in 2014 only wants 90 days of reporting time. But this 90 days, it's fixed quarter of the year. That is, it has to be done in January to March, April to June. You cannot do February to April. It has to be the fixed quarter of the year. So you should be doing Meaningful Use 2 in 2014 in the first quarter. If you can't do it, then you have to wait till the second quarter. And once you're done with that 2014, then you'll do the full year in 2014 and 2016. Also, recently, CMS has announced that they have pushed back the penalties from 2016-2017. So it give you one more year to start implementing Meaningful Use Stage 2 before you get penalized of not using it in 2017. If you are the one who just start using Meaningful Use Stage 1 in 2013, then you are required to report for 3 months in 2013, and then you still be doing Meaningful Use Stage 1 in 2014, but your EHR should still be 2014 certified EHR, and you are limited to the quarter of the year. So you can do it in January to March and April to June in the year 2014 for Meaningful Use Stage 1. Then you start Meaningful Use Stage 2 in 2014. And for the 2014 next year, they're starting it out, then you have to do Meaningful Use Stage 1 and start from there.
And I'd like to let all the providers that aren't part of MTBC know that MTBC does have a 2014 certified EHR. So if they were interested in seeing the EHR, they can always contact our support team and get a demo of our 2014 certified MU Stage 2 EHR. Now, one question I think a lot of providers ask me is regarding 2014. As you mentioned earlier, 2014 is a regulatory storm, and there's a lot of requirements that need to be met. Now, can you break down what the ideal timeline is in 2014 that providers can follow so they can adequately meet these requirements and not worry about lagging behind and perhaps not meeting one of these two rules?
So to do that, I think let's focus on when did you start implementing meaningful use. If you did meaningful use stage 1 in 2012 and before, then 2014 is the year for you to implement meaningful use stage 2. And that means you should try to go for the first quarter of 2014 for meaningful use stage 2. If you can't do it, then go for the second quarter of 2014 meaningful use stage 2. But keep in mind, starting January, and you should have already done that, but if not, you should start right away to prepare for ICD-10 implementation. Because ICD-10 implementation requires multiple things. You have to make sure that your EHR vendor is capable of having ICD-10 codes. And if not, what are their plans? Are they going to help you? If they have any support for you, just to know that vendor is not responsible for ICD-10 implementation. It's your practice. There is a lot of things you have to make change in your practice to be able to compliant with ICD-10 implementation October 1st. You have to make sure your third-party payer and clearinghouse also have some plan in place to prepare for ICD-10 October 1st. You have to make a big change, and you have to make a big change in your workflow that will prepare you to prepare for the ICD-10 compliance, which involves physicians, staffs, medical biller, nurses, and a whole group of people that have to work together to make that happen. And you also need some time to be able to test ICD-10 billing, because you probably won't have time until September 30th. You will be doing ICD-10 billing, and October 1st, it's going to move to ICD-9 billing September 30th, and ICD-10 October 1st in one day. That means you need to be prepared to switch to ICD-10 right away. You need to be able to do how to do ICD-10 billing. Your providers, your medical billers, your billing companies all need to be able to process your claims for ICD with the ICD-10 codes. Your super bills need to be changed right away that have ICD-10 codes. And we're going to have a separate webinar that's going to focus on all that in detail. So it's very important that you keep all that in mind while implementing both meaningful use 2 and ICD-10 for 2014.
Yeah, and again, I would like to stress that MTBC is going to be capable of handling ICD-10 codes by the deadline Dr. Gupta has specified. In addition, the clearinghouse that we work with, which is MDON, also said they were preparing for meeting this ICD-10 compliance and to handle those ICD-10 codes. Finally, I'd like to thank Dr. Gupta for spending his time and talking to us about MU Stage 2 and ICD-10. Please join us for our next webinar, as Dr. Gupta mentioned, which will clearly go into these ICD-10 guidelines as well as the Meaningful Use Stage 2 workflow changes that providers have to make to meet these two regulations. Now, one of the things MTBC would also encourage providers to do is contact Dr. Gupta at askgupta@mtbc.com. In addition, you can also contact me at pkonda@mtbc.com or call me at my office line at 732-873-5133, extension 134. And finally, we also offer 24/7 support in terms of meaningful use, and actually our meaningful use team are actually the ones that also certified us for Stage 2 certification. So you can also contact those members at 732-873-5133, extension 308. Again, I'd like to thank Dr. Gupta and the providers that are listening for their time, and I hope this webinar has been educational in terms of you understanding these two rules. Thank you.
Thank you.